Cardiovascular circulation, something that we all take for granted. What do you think would happen if the arteries in your heart became heavily calcified and nearly closed off? In addition to that, blood clots form in your major veins in your upper extremities. We're going to discuss such a case coming up next. Welcome to Montgomery Heart Wellness Clinical Rounds. Today we're going to discuss a patient who flew in from Spain because he had a progressively increase in calcium score, which, Camille, I remember talking to this patient, a 66-year-old man who he called our office, and apparently he had looked at centers all over the world, and he saw our information online. And when I spoke with him, he stated that he had an initial calcium score of 800. And in less than 2 years, it went from 800 to 1500, which I thought, God, that's remarkable fast. Now, he had a coronary angiogram, CT coronary angiogram, which showed 5 different vessels had significant obstruction ranging from 30% to 95%. Now, he did not have crushing chest discomfort, but when he would exercise, he would try to jog a mile. We get winded, be short of breath, and that type of thing. His kidney function was normal, and so on and so forth. So he had some pretty interesting clinical findings. Now, he had a stress test that was normal.
Right.
Now, what do you make of that?
A normal perfusion stress test, it can appear normal if all the vessels or most of the large vessels are blocked significantly or equally. We see that a lot.
Yeah, and the thing is this, you can have they call it a balance defect. So if all the vessels are equally diseased, when you look at a perfusion study, the perfusion throughout the heart is the same. And so the person that reads it says, well, it's all the same, so it's normal, but it's not normal, it's all equally diseased. And so that's probably what was going on with him. And the other issue is like calcium. Now, when you see someone this much calcium that's progressing, what do you think about?
You definitely think about the parathyroid gland, because parathyroid hormone regulates our blood calcium levels, because that is a really high increase in 2 years.
So one thing I want the audience to take home, if you had a calcium score and it's really high, you may ask your doctor just to check a parathyroid hormone level, because people with parathyroid adenoma can have a rapidly progressing coronary disease, and that's what we thought of in this patient, in which case you want to have that addressed, because not only have to address the heart disease, but you have to address the parathyroid adenoma, because it's only going to come back. Mm-hmm. So that was one thing, but his parathyroid hormone was normal, so we didn't see this. So essentially, we have a 66-year-old man with rapidly progressive coronary disease. He had a normal parathyroid hormone, and he had some atypical symptoms. He would get winded, but he could jog up to a mile, but he wasn't as energetic as he used to be. So you look at someone like him, he wasn't overweight at all,
right?
And he looked physically fit. In a normal stress test, he probably wouldn't have even done an angiogram on this patient, but he probably felt enough symptoms where he had it done anyway. So he came to us because he wanted to reverse this naturally. Okay, so we did our clinical evaluation. So what did the echo show?
It showed a good pumping of the heart. We call that the good ejection fraction. He had some mild stiffness. We call that diastolic dysfunction. That's pretty common. Mildly increased pressure in the right side of the heart, which can mean some lung disease, blood clots. It can be seen in left heart disease. We weren't overly concerned with that though.
Yeah. So we had him scheduled to start some infusion therapy. So because of the calcification, we had him scheduled for ozone infusion. It improves mitochondrial function. He was scheduled to start chelation therapy, plaque X. These are therapies that we use to help open up arteries, non-invasive, that can be very effective. And there were some other supplement therapies, of course, the nutritional detox. But when we went to start the veins, what did we find?
We could not get venous access, and when y'all used the ultrasound guidance, there were lots of blood clots.
And here's what we saw. So this is a video that shows a blood clot on his arm, and we saw this on both sides. But here, this is a vein, and this is an artery. Now, normally, what the sonographer does, he compresses this because a vein is collapsible, artery is not. So he'll go through and press and see if he can flatten this out. And as you can see, there's a sensation trying to compress, but it doesn't flatten out. And that tells him that there is a clot in there. And you can see the little haziness right there with a blood clot. And the next thing sonographer will do is he will then run a Doppler to see the flow. And you can see the flow is not going through it. This artery has flow all the way through it, but there's no flow coming through here. It's only going through this small little segment. So that tells you there's mostly obstruction in this. And then he turns a probe around and gets a long view. And here you can see that big clot right there in that artery, and the flow butts up against that clot. You see a tiny bit going through here, but you don't see much flow. In fact, it gets completely obstructed. So you probably had tiny little vessels that may have given him flow back to the heart, but that was obstructed. So this was a major problem. We had to start some IVs in the feet. So what was our next approach? We had these clots. He needed IVs, which could have been, most of the clots that are dangerous start from the leg. These could cause a problem because they were in the deep veins in the upper extremity. So it wasn't anything that we wanted to mess around with.
Right.
So our next approach is what?
We started the nattokinase, and that acts like an enzyme to help break down the clots.
Yeah. And serrapeptase also, which has a strong enzymatic function. And you may not be familiar with these drugs. We won't go into the details, and they're not drugs, they're supplements. But the nattokinase comes from the Japanese soybean, so it's an enzyme, and it biochemically dissolves blood clots. And serrapeptase is a stronger enzyme, and it also has a biochemical effects that dissolve blood clots as well. And so this is something that we were able to use in him. Of course, he stayed on the raw detox diet, and we followed him. And so we repeated the ultrasound, and within 5 days, again, 5 days, this is what we saw. So we took another look because we were doing serial ultrasounds, and notice here, you can see this vein flattens out. Still a little bit of something maybe right there, but you can see the big difference. It flattens out very easy when the sonographer tries to compress compared to before. When he tried to compress before, there you see the clot, it doesn't flatten at all. So there's a nice before and after. He also looked at the long view when he ran Doppler and see how that beautiful flow all throughout that vein. No clot, maybe a little tiny something there. This is only within 5 days, maybe 5.5 days, compared to before before we started the serrapeptase and nattokinase obstruction there. And so he had very significant obstruction compared to before and after. So we had a very good result. We were excited about that, and we continue to follow him. We were able to put a PICC line and a midline up in these large vessels, and he was able to start resuming his other infusions. And we have more work to do with this patient, but this is an excellent example of how you can biochemically dissolve blood clots using optimal nutrition, some natural enzymatic substances, and it's safe and effective. And we saw results in a short period of time. We've seen other patients with similar results. Any final comments, thoughts on this patient?
I mean, it was really exciting to see how quickly that opened up the vein. So that was great.
Yeah, and he was very relieved because he was really surprised to know his veins were clotted, and he was really nervous about that. So we got a great result. I hope you got a lot out of this, and until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification